Alright, this should work. I'm gonna have to replay it, so I'm gonna go step out in the living room since you don't want me to listen to it.
Oh, okay.
Well, what were you bitching at me about?
Hello, my name is Hailey Epperson, and I will be discussing Chapter 12, which is Psychological Disorders. I will be talking about the anxiety disorders and the different types. We have 5 different types. We have phobic disorder, panic disorder, obsessive-compulsive disorder, acute stress disorder, and post-traumatic stress disorder. Each of these will have their own slide, and I will be explaining a little bit about each and what they mean, some signs and symptoms, and I will also be incorporating myself to aid in an example for you to understand a little better. First up, we have a phobic disorder, which a phobia is an irrational, persistent fear of something. One of the biggest fears is social phobia, which is a social anxiety disorder. It's when one fears to be in large groups and interact socially. Many people actually have this phobia. They tend to get very nervous when giving a speech. They also have stage fright, but it's not really as common as you would think for someone to be scared to go to the public restroom. But you would be amazed on how many people are. I was one of them, but now I kind of grew out of it. So for certain people, it'll last lifetime, others not so much. And then there are many names for all the different types of phobias, which we will classify as a specific phobia. And some examples of that would be a claustrophobia, which is where one has a fear of being in a small enclosed space. They also have zoophobia, which is a fear of animals. And a lot of people have acrophobia, which is a fear of heights. I actually have a fear of, I believe it's called trigophobia. It's those who are afraid of tiny holes in clusters. I don't know what it is, but that kind of freaks me out a little bit. But anyways, we'll go on to the next slide, which is a panic disorder. This is only classified as a disorder if it occurs on a daily basis and negatively affects the ability to care for themselves or perform activities of daily living. A panic attack is not anything physical, but it's a more psychological issue. They are in a state of terror and have no means of understanding what is going on with themselves or the environment. For those of you who have not had a panic attack, it almost feels as if you're having a heart attack. It's very difficult to breathe. It is very difficult to calm down. It is very difficult to relax. You're extremely tense. It almost feels as if you are having a heart attack, and there's no way to control it. So many people tend to try to prevent or avoid triggers of panic attacks, which this can lead to phobias. Like many people, they may have a panic attack in a social area, like going to the supermarket, so that may lead to a phobia of going to certain places. So like a lot of people have agoraphobia, which is a fear of being in a place or a situation from which escape is difficult or impossible. So if you're in the middle of doing something, it's kind of hard to just pack up and leave. The next slide, we have obsessive-compulsive disorder, which is when intruding thoughts constantly recur, and this may also cause ritualistic behaviors. By this, I mean they are constantly doing the same thing repetitively, almost as if it's a ritual. Like, let's say, for example, if you have OCD, you go into the bathroom and you are constantly washing your hands because you don't feel as if you have all the germs off of your hands. Or I used to do this. I would walk up and down stairs and I would count each and every stair. And I had a thing about it had to be even, or I was in a weird state. So, or another example would be everything has to be in order. You can't mix colors for snacks, food foods can't touch, certain things like that. Many people are very OCD about that. But the big difference between a normal jazz music, books, movies, is that they actually enjoy that. Rather with OCD, they feel as if they are compelled to do the same thing over and over and over, and they are almost forced to enjoy it, but in the end they really don't. On this next slide, we have acute stress disorder. This results from a catastrophe or exposure to an extreme stressor. One of the examples I read was Hurricane Katrina. Many of the people who survived that actually had this happen to them, and some signs and symptoms would be anxiety, recurring nightmares, sleep disturbances, difficulty concentrating, and they feel as if they relived the experience. This typically does not begin for 4 weeks after the experience, and it tends to relive for a month after the 4 weeks. Now we have post-traumatic stress disorder, which is quite similar to acute stress disorder, but one of the biggest things that makes them different is PTSD can last up to 2 years or even longer, and like I said in the past slide, is ASD typically only lasts 1 month. For PTSD, many may need psychotherapy and or drugs to help with the anxiety. And I also read that the hippocampus is affected in children with PTSD. It tends to decrease in size, which can then lead to impaired long-term memory, and it can also cause a decrease in their learning ability. So always look out for this. Know how to treat a child, because in the long run this can constantly affect them. And my favorite one of all is generalized anxiety disorder, which I was diagnosed with a couple months ago. They are known as the worry warts. They have no reason to worry, yet they still do. This occurs more days than not in 6 months. So out of 7 days a week, you worry about 5 of the days. Some signs and symptoms would be muscle aches. You are very tired, lethargic. You have a difficult time concentrating, and you get tense and very edgy. One of the things I noticed with this was I always had a difficult time falling asleep. I had a hard time kind of interacting with other people. I was constantly worrying about things that didn't matter at the point in time that I was worrying about them. I'd be in bed and worry about laundry that needs to be folded, when in the end it's pretty much irrelevant. So I went in a few months ago and I was prescribed 2 different medications. I was prescribed duloxetine, which is also known as Cymbalta, and then I was also prescribed Xanax, which is an as-needed medication for when I have panic attacks due to my anxiety. With the Cymbalta and the Xanax, they tend to have you come in a month after the treatment has started to ensure that the dose they have you on is appropriate, and also ensure that it is working and whether or not they need to increase or decrease the dose given. Many times, people with generalized anxiety disorder tend to not know it, or it doesn't become apparent until you really have things to worry about, like bills, homework, whether or not you're going to pass that test, whether or not you're going to graduate, whether or not you're going to pass that licensing exam to get your license of some sort. So with this, it kind of just starts adding up. You start noticing the signs, but it's not as apparent as it should be until you start getting the panic attacks, and then that's when you realize maybe I do have the anxiety disorder. But that is my story, and that is all I really have to say about these. So I hope you enjoyed, and here are my references. Thank you for listening.
That was a good ending.
You really think so?